But in the early 1900s, 1918, with the Spanish flu, there was a doctor that, similar to COVID, was like, these people aren't oxygenating well. Something's wrong. Go get me one of those dive chambers. I'm going to start putting people in it. And that really started. I mean, his patients were faring better than anyone else because they had more oxygen. So that really started kickstarting a lot of the research on what else can this be used for? How does this help things?
Welcome to the show, and it's a pleasure to have Nicole Garrett. Welcome.
Thank you. Thanks for having me.
So today we're going to talk about hyperbaric oxygen therapy, HBOT. We haven't covered that yet in this podcast, surprisingly, because it's such a biohack that people are really into. And I've heard some amazing things about it. I've tried it once myself, but I know to get results or see differences, you have to do this multiple times. And I understand that there are different types of chambers. And I want to take a deep dive into what is HBOT and who's it for and how it can help a woman through menopause and what to look out for if we want to get a session or not. So let's first kind of start from the very beginning, the 101 on what is hyperbaric oxygen therapy.
Yeah, so hyperbaric oxygen therapy, what we do is we put you in a chamber and we pressurize it, and we're using the physics to dissolve oxygen in all of your body fluids. So think of like a soda that's carbonated. And by using the pressure to get the oxygen in your body, we actually cheat where it can go and what it can do. So if you've got compromised blood flow for some reason, all the fluids surrounding that, the swelling you may have from joint pain, is now hyperoxygenated. And by doing a series of treatments, we actually grow new blood vessels. So we fix that long-term oxygen deprivation.
Oh, wow. Okay. Quite good in a nutshell.
In a nutshell,
Very
yeah.
simple. But maybe describe also, so the one that I went into looked like a big silver trailer bullet from the 1960s, those silver things.
Yeah.
But there were different, there was two different rooms, and I think there must have been about 10 people in there. And so we walked in and then just went psh, like sealed the doors shut. And
Yeah.
some women were feeling like woozy, and there was a Mother's Day special or something that like we got all free access to this chamber, and they started feeling woozy, not so good. But most people were just on their computer chilling. Some were just chatting around, and some were eating grapes and like doing their thing. And I think it was about an hour in there. And that's it. And then you left. But I understand also there's some that you lie down in. It looks like a bed or like a sun bed. And then you lay down there as a single person. So maybe talk us through what is an experience like when somebody gets this treatment.
Yeah. So what you went in is called a multi-place chamber. Multiple people can go in. And then you usually get your oxygen on a mask or a hood. There are some different ways to deliver it. And then the opposite is a monoplace, a single person chamber. A well-built chamber is going to be a hard design chamber. So yours look like big steel silver bullet. They're usually made out of metal because it's very strong. Some of the single person chambers are also made out of a clear acrylic that's about 3-4 inches thick that can hold the pressure well. And those are nice because you don't have as much claustrophobia. You can see out to the people outside and what's going on. You can communicate well. But the physics are the same for both situations. We're increasing the pressure. The first thing you feel when you're inside the chamber is pressure on your ears. It's the exact opposite of flying in an airplane. In fact, anyone who's been in an airplane has technically been in a hyperbaric chamber. They pressurize the inside of the cabin because there's not enough pressure outside to maintain the oxygen with how high we fly. So most people have already been in some form of this, but you clear your ears just like when you're flying, and then you hang out, you breathe, and we come back to the surface. Your ears clear on their own. And that's it. As far as therapies go, it's pretty safe as long as you're with the right equipment and people, and pretty benign.
Mm-hmm. So I understood this technology came out of people who were astronauts and landing in this back to Earth, or they were scuba divers and coming back also to sea level. So how did this technology even come in the first place? Explain a little bit more.
Yeah, so we've been using hyperbaric chambers since the 1600s. A lot with
1600s? What?
1600s. Yep. There's drawings of these bellows where you ride a bicycle to help compress the air. And they actually used to do surgeries in hyperbaric chambers because we didn't know what oxygen was till the 1700s. So they just knew if they did surgery inside the chamber, the patient didn't turn as blue. Because even though they didn't have oxygen, the increased pressure of air was getting you more oxygen. So the patient had a better outcome. Eventually, they discovered what oxygen was and stopped doing surgery in the chamber. But they started learning what other applications it was good for. And when it became a lot more mainstream, they had some hyperbaric hospitals for a while, and you would just go live inside a hyperbaric hospital for a couple weeks, usually for diabetics.
I'm trying to imagine how they were creating the pressure back in the 1600s, 1700s, even 1800s. How did that, what was that like?
Yeah, the drawings I've seen, you have a big steel chamber, kind of like you went in. So like a
Mhm.
big metal room. And then they had these, if you think of the old, it looks like the little things that, on cartoons that blow up the fireplace that you
Mhm.
squeeze together. And they had a bicycle that would make those go back and forth. So just think of like a bicycle pump. So they could compress small amounts of air and push it in the chamber and compress it.
Okay. So we're compressing more air in there. And so the pressure is getting higher in
Yep.
the chamber. And I
Yep.
understand that there are different levels of pressure, perhaps for different things.
So the majority of all the research shows that the minimum pressure to be effective is 2 atmospheres, which is double the pressure of sea level. So that's where you really want to start. That's great for all your soft tissue injuries, your muscle, your subcutaneous. If you had radiation from cancer treatments, it's going to help with all of that. If you have bone infection or some of the denser tissues, then we go to 2.5 atmospheres.
Hmm.
And then past 3 atmospheres, you cannot breathe 100% oxygen. It's too toxic. It's too much oxygen. But even when we treat scuba divers, because they have maybe a really deep injury, after 3 atmospheres, we start mixing gases because you can't give them 100%. So we'll give them a mix of nitrogen and oxygen to dilute the oxygen a little bit.
I interrupted you at the moment you were talking about how in the modern world now we discovered this and we started using them with astronauts or scuba divers or what was.
We still use them to treat decompression sickness, and you can get that if you've been diving all day, or if you're an astronaut, you live at surface pressure, but going up in space is less pressure. So the physics is kind of the same as a scuba diver getting decompression sickness. But in the early 1900s, 1918, with the Spanish flu, there was a doctor that, similar to COVID, was like, these people aren't oxygenating well, something's wrong. Go get me one of those dive chambers. I'm going to start putting people in it. And that really started. I mean, his patients were faring better than anyone else because they had more oxygen. So that really started kickstarting a lot of the research on what else can this be used for? How does this help things? So that's when it became more semi-mainstream in healthcare in the US.
So the idea is to oxygenate the blood, right? Creating this pressure to oxygenate the blood.
It's
That's.
not just oxygenating the blood, it's oxygenating your tissues. We get enough oxygen in there that you don't need your red blood cells. You're so saturated that we can bypass that. And that's where the power comes from, because if you have areas that your red blood cells can't get to because you have a disease process like diabetes, or you have injuries that crush those little blood vessels, like you tore something, all that swelling in there is full of oxygen now. Think of that soda that's carbonated. And so by giving you that rush of oxygen for 1 or 2 hours, and then you come out of the chamber and we take it away, that's what stimulates your body to grow the new blood vessels. It's like, I had something there and now it's gone. I'm going to fix it. And that's why you need a series. You need that repeated exposure to show your body where the deficits are, and it kickstarts that healing.
Mm. So I haven't heard the word oxygenation and getting more into the tissues. And I'm wondering then how does hyperbaric oxygen therapy compare to things that oxygenate the blood about oxygenating the blood, for example, is breath work. And I don't know how much it oxygenates the tissue, but we know if you have more oxygen in the blood, then the tissue can get more oxygen. And it sounds like maybe it's next level, but then regenerating tissue, I'm thinking about platelet rich plasma injections, or perhaps some kind of peptides as well to create angiogenesis, create more blood vessels. There's the blood flow restriction bands out there and red light therapy to reduce inflammation. So a lot of these things I just mentioned kind of have the same objective or mechanisms of action. So how does HBOT differ?
Therapy with all of those, and it can make each one of those more powerful when you put it together. If you think about, let's start with red light therapy, you're looking at an outside in. So it's going to penetrate from the skin down as far as it can because it's going from the outside in. When you use hyperbaric oxygen therapy, because you're breathing to get the oxygen, you're going inside out.
Mm.
And so red light therapy is great for surface level or joint pain, but if you have some deeper tissue damage, it's not going to be able to penetrate there. And so that's where hyperbaric oxygen therapy is really powerful, as it goes from the inside out. When you look at PRP or even stem cell therapy, PRP, we're taking the patient's own plasma and platelets and re-injecting it. We can increase the uptake of the PRP or the stem cells with hyperbaric oxygen therapy. So with any stem cell injection, we usually have you do 3 treatments within the first 24 hours afterwards to potentiate how much you keep. And that's still a very localized, where we're going everywhere. So they're really good therapy to do together.
So it's sort of stacking some therapies to try to supercharge them and get even more benefits from it. And okay, but you don't have to. You can still get great benefits without doing some of these extra treatments, right?
Oh, absolutely. Yeah.
Okay. Okay. Super interesting. It's pain-free, at least for the way I experienced it, unless you have some of the air pressure. But let's talk about some of the benefits and then some of the risks of hyperbaric treatment, because the benefits sound fabulous. You're lowering inflammation, you're bringing more blood flow, you're getting better oxygen to the tissues. So of course you may have better outcomes, but let's put it in the context of a woman going through menopause and the menopause symptoms. And let's say the silent killers for like osteoporosis, for example, her bones are becoming more brittle, not just looking at hot flashes and what hyperbaric can do for that. I don't even know if that's sort of going a little bit too far, but are there any things that a woman going through this menopausal transition can benefit from using hyperbaric oxygen therapy?
Yeah. It can really help with some of your sleep patterns, which, as someone who's entered perimenopause herself, is starting to get all the wonderful things that come with that. So getting to sleep, staying asleep, which has been the big problem for me. So I try to jump in the chamber a couple times a week when I feel like my hormones are doing whatever they decided to do this week. And then also looking at some of your skin changes. It's great for stimulating collagen synthesis. There's a lot of research on anti-aging on a deeper level with that. But I know my skin started to get a lot drier, so all the fine lines seem to be more pronounced in the last couple of years. And then as far as osteoporosis, I mean, they're really starting to do a lot more research with hyperbaric oxygen therapy in menopause. So everything's pretty experimental. But when you can get oxygen deep penetrating into the bone, and a lot of the issues with menopause is decreased blood flow to areas, which is why you have clitoral atrophy, you start getting more of the joint pain. The theory behind it would be that it is, in fact, going to be helpful long term.
How does it help? What's the mechanism of action in terms of helping with sleep? Why does it work?
All of our patients will tell you I sleep better when I'm doing a series of hyperbaric. I think it's just hyperoxygenating the brain. And you kind of get a full lymphatic flush when your whole body is going under pressure. So I don't know, and that they don't fully know, other than you can do scans and see certain areas are lighting up better than not. The theory behind it is just hyperoxygenating the brain, getting it to areas that weren't getting it, and then also clearing out some of the toxins in areas.
Yeah, because I teach some women how to breathe through menopause and how to use their breath in terms of lowering stress and anxiety, but also to sleep better. So some of the techniques I teach them is about breathing through the nose only, not through the mouth, as well as breathing lower and lighter and fewer breaths per minute. So and this is helping with the oxygenation of the blood, maybe not as much or getting the tissue as a hyperbaric, but I'm thinking, and we're using this for sleep as well. So before they go to bed, and it's really, really effective. But when you go into a chamber, you're just breathing normally. You're not instructed to breathe through mouth or nose, or correct?
Yeah, we're cheating how we get the oxygen and how much. But to your point, if you can't get into a hyperbaric chamber or you can't afford to go very often, like Wim Hof style breathing, where you are hyperoxygenating, has been shown to do some of the same effects. So it makes sense that you are seeing some of the results you're seeing because you are hyperoxygenating. If you do breath work, you can drive more oxygen into your tissues.
The way I learned it is more breathing lower, slower, lighter. It's the opposite of Wim Hof. So when you are getting that signal to your brain that you have air hunger, right? So if you're trying to breathe low and light, it's almost like you're almost not breathing, and fewer breaths per minute, and just controlling that. That's when hemoglobin, which is holding, what is it, like 90 percent of the oxygen of it is holding really, really tight to it. And when we're getting that signal to the brain and breathing light, that's when it's released into the bloodstream. And the Wim Hof, and so you're basically becoming more tolerant to carbon dioxide, and it's building up, building up, building up, and then you're relaxed. Whereas when you do Wim Hof, you're exhaling all of the carbon dioxide, so you're not getting that sensitivity. So I thought it was the opposite. And I was thinking, if I'm taught this way, and this is the way we oxygenate the blood, then the Wim Hof style is the way we deoxygenate the blood. And there's other benefits. There's a reason why he teaches this, but I'm trying to wrap my head around, like, how does that breathing oxygenate the body more?
Some of it has to do with, and this is something we've done a lot of research in hyperbarics with COPD patients, because it used to be, don't ever put them in a chamber. They'll stop breathing because their triggers to breathe are off because of that. It's just which mechanism you're using. So you may be using the CO2 mechanism to trigger breathing more, whereas he's hyperoxygenating more, but you're still going to get a buildup of that carbon dioxide. You're going to get like lactic acid buildup in your blood. Ultimately, I think they achieve the same thing. It's just which route you're going to get there.
Okay. There are many benefits of this. And you did mention earlier to me off camera that a woman who is going through breast cancer treatment could benefit. And not that all menopausal women have breast cancer, but it's around this age where sometimes this happens. So how are you helping women through that breast cancer?
Yeah, so what breast cancer comes a lot of surgeries usually, and the most common is a mastectomy. And Beverly Hills, where we're located, has pioneered the nipple-sparing mastectomies, because it used to be they just take everything. But what they do is they lift off the skin, take all the tissue underneath, and put the skin back down and cross their fingers. They've killed the whole blood supply. So we use the hyperbarics to keep the tissue alive and then reestablish the blood supply. There's also a ton of research with cancer and hyperbarics. Breast cancer specifically does not like oxygen. So we will use it in conjunction with chemo and radiation. We can give you lower doses of the chemo. It becomes more toxic to the cancer. And because it's lower doses, you can actually have less side effects and protect your cells. And then after a course of radiation, the goal of radiation is to kill the blood supply to the cancer. But then you have complications healing after that because there's no blood to all the surrounding tissues. Hyperbarics will come in and reverse all that damage. So we use it for any one of those three areas.
I'm a little confused now because I understood the hyperbaric oxygen therapy is bringing more blood flow, more oxygen. And you said cancer doesn't like oxygen, but it probably likes blood flow, or it needs nutrients. But I thought actually it would be the opposite. And again, this shows my naivety with cancer, but I would think, oh, they probably need to grow or multiply or get a blood supply or get blood flow and help it to grow. So where am I going misunderstanding?
No, that was the belief process for years. And through lots of research, and a lot of its pathology is if you take out a tumor and look at it, so normal healthy cells, you have an artery that goes into capillaries, and then into capillaries into your vein, and it comes back. And it's this nice, neat little network. When you look at a tumor for a cancer inside, it likes to pull a lot of blood. They're very vascular. But all the little, all the little capillaries and blood vessels deaden off. They don't go through. So it's pulling in nutrients, but not a lot of oxygen. And so when you hyperoxygenate that, radiation was approved for hyperbaric therapy. They would put you in the hyperbaric chamber, do a treatment, and within 15 minutes, do the radiation. And the cancer would be super open because it's trying to get rid of the oxygen, and you get the radiation right into the tumor.
Wow.
So for a long time, they were like, if you have cancer, do not get in a hyperbaric chamber. It's going to make it worse. And we have learned that it's actually the opposite. We can see a lot of shrinking. It very much complements the other therapies we use to get rid of it, because we can increase their potency and, again, protect your healthy cells. I wouldn't just use it by itself by any means, but it's a great tool to add to those therapies and make them much more effective.
So if somebody was getting their chemotherapy, they would go to a chamber the day before or an hour before?
With chemotherapy, there's a couple chemotherapy drugs that are contraindicated with the hyperbarics. Some of them are trying to kill the blood supply one way, and if we're regrowing it, then we're just kind of playing tug of war. But they also have shorter half-lives. So this is where we get very involved with the oncologist. And we do timing on, okay, this drug, we want to wait 3 days and then we're going to put you in the chamber. This drug has no cross interference. We're going to do a normal series in conjunction and track everything, but we may adjust your chemo doses. So each one's got kind of an individual protocol based on tumor type, what chemicals we're using, all those things.
So what does she see in terms of the difference of combining hyperbaric with it? Does she have fewer chemo sessions, lower chemo drugs, or why should she combine these two?
Yeah, a lot of times they can end sessions early. Like they may plan to do 12 sessions, but they're seeing a response much faster. Again, we usually work with the oncologist because they will lower the dose because it does get more effective. And then also the side effects are much more mitigated, which is huge. Anyone who's gone through chemo, I mean, my mom went through it all. I watched it firsthand with her. If you can alleviate a lot of those side effects and the nausea and the hair loss, then it can be a huge difference in quality of life while you're going through the process.
Okay, so it helps with the side effects of the chemo too, that's
Oh, yeah.
huge because it's easier to tolerate. Does it
Yes.
help with people from losing their hair with chemo?
It can, not all, but it can. So
Mhm.
we have a lot of patients that get kind of I already rock the short haircut, but the short hair in anticipation of I may have to shave it. And they're like, oh, I never had to. It was great. But then we have some where it doesn't. So it also depends on how severe, what specific things they're targeting in your body, on what cells it goes after.
Hmm. So I imagine it's also great for people who are getting surgeries because I just had a hip surgery, two hip surgeries, and you have the scar and you have the healing and you have so many hacks for that. But women, as we're getting older, it's not uncommon to have a surgery or a mastectomy or a hysterectomy, all of these things. So does this accelerate the healing process?
Yeah, it 100% accelerates healing and it reduces scarring.
Mhm.
So most patients do between 10 and 20 treatments after surgery, depending upon how involved the surgery is. Hip replacement, bone, really dense tissue type stuff tends to go a little bit longer just because it's harder to get that oxygen in there. But even from an aesthetic person, it's just reducing the scarring and the scar tissue buildup because that scar tissue being really dense will affect your outcome, not just aesthetically. So if we can reduce that scar tissue buildup, then you can have a better outcome.
So if they were to do 10 sessions or 20 sessions, then how much space do you leave in between each session?
Come daily. Usually
Daily.
Monday through Friday. Yep. Yeah, you just had an acute injury, whether it be intentional with surgery or a car accident. You want to heal as fast as possible. The more you draw it out, the more you're going to scar, the more risk for infection or complications. So you just come in right away. After about 6 hours, the oxygen tensions in your blood drop off. And that's when your body goes, okay, I'm going to start growing those blood vessels. I'm going to start releasing stem cells. I'm going to start doing all those things. And then each treatment lasts 24 to 48 hours as far as some of the anti inflammatory effects. So if you can come every day, you get a really good buildup of traction. And again, just trying to heal it as fast as possible.
Mm.
Don't give it room for complications.
So depending if you have a minor surgery, I guess you can go in right away. But if you have a major surgery, sometimes you're in the hospital for a few days or just not feeling up to moving around so much. You could leave 4, 5, 6 days until you go for your first
Yeah,
session.
as soon as you're able. We also have a huge wound care center and surgery center that we operate. We take people right out of the OR as soon as they're
Mhm.
awake and have some food. We'll put them in. But it's for the ones that need to be inpatient, we wait till they're out of the hospital. But as soon as you can get in there, if you can clear your ears, all you have to do is relax and breathe and start your healing process.
And how long is one session?
Between 1 and 2 hours.
Yeah, I had a friend who went to Tel Aviv where this 2020 study came out from Tel Aviv University and the Shamir Medical Center. And this was, I think, a groundbreaking study
Yeah.
that made headlines because it showed that hyperbaric oxygen therapy stopped the telomeres from shortening and then lowered the accumulation of senescent cells. And this was a study done on adults over 64. Just so people know, telomeres are the caps on the ends of your chromosomes, and they shorten as we age, and we don't want them to shorten too fast. And the senescent cells are those rogue cells or zombie cells that just cause inflammation, cause havoc in our body. So we don't want a buildup of this. So that was pretty impressive. And so it just basically proved that hyperbaric can slow down aging at a cellular level. which is fabulous and something that we really need. But it was like, I think it was 3 months. It was like a full-time job every
Yeah.
day, Monday to Friday. And I think she spent like half a day in there. It was quite intense. So I don't know the difference. I mean, this is a big clinic, and obviously many people are in there at the same time, kind of like me, multiple people. What do you see as the difference between doing a big room like that, or quote unquote professional or clinic style, versus going to a gym and you sit in these little tubes, one person mono tube?
A monoplace or a multiplace, if you have the hospital grade, is going to be the same. So, like UCLA Medical Center in Los Angeles here has a big multi-place like the Tel Aviv clinic, like kind of like you went into. But there's Sherman Oaks Hospital up the street has a monoplace, or the Grossman Burn Center, one of the most famous burn centers here. They have a monoplace, but they're hospital grade. So you're still going to the same pressure and you're still getting 100% medical grade oxygen. Your outcome will be the same. But if you're going to some of the smaller offices, gyms, med spas, they usually have low pressure chambers. So you're not going to get as much pressure in those. And without the pressure, you don't get the results. You have to go deep enough to click on those mechanisms of action to release the stem cells, start killing the sentient cells. It's actually bacteriostatic and has antiviral properties. But again, you have to go deep enough, get the tensions of oxygen high enough to achieve that outcome. And so that's where the difference starts to come in.
So you need to ask the person who's selling you this package how many, is it a minimum of two atmospheres, or
Yeah.
atmospheres?
Two
Or 2.5?
atmospheres, which is like 33 feet seawater for our scuba divers out there, or 14.7 psi, our nurses like pressure and stuff. But yeah, that's all the same thing. So that's where you begin to get the benefits. For the Tel Aviv study, I think they went to 2.4, 2.5 atmospheres. So a little bit deeper. And that's where you kind of get deeper into the bone tissue, because that's just a dense tissue. So you got to go a bit deeper to push it in.
So if somebody responds, no, I only have 1 or 1.5 atmospheres, should they pass on and try to find something with more atmospheres?
Yeah, I would pass on that for a couple of reasons. One being it's not enough pressure to get benefit. So if you go somewhere and they're like, treatment's $100 or $150, even $200, you can pretty much guarantee you're not getting in a real chamber. The other reason I would pass on it is almost all of those chambers are not legally operated in the US from a safety standpoint. So they don't meet our safety standards. Even the bag chambers that are sold out there, they're approved for altitude sickness or mountain sickness, and they're not approved to operate with oxygen. So if you're getting oxygen in those, you have a pretty high fire risk because they didn't meet the standards for oxygen. They're there to just trying to get you out of altitude sickness with pressure.
You mentioned that not only is the quality of the chamber or bag very important, but the person behind it, operating it, is also key. How do we know if there's somebody we can trust behind that?
So there is a certification process, even for technicians, nurses, and doctors. They all should have the UHMS course. For technicians, they will have a CHT license. For nurses, it would be a CHRN. There's even a veterinary hyperbaric technician, because we do treat horses and dogs and cats and all kinds of animals in hyperbaric chambers. So having them be licensed is huge. The doctor having the right training's important too. Because we, in hyperbaric medicine, the hyperbaric technician is one of the only areas that can tell a doctor we're not going to treat, because the technician's going to be thinking of all the safety things. That shouldn't go in the chamber. There's a petroleum-based dressing on that wound. That shouldn't go in the chamber. That patient's got an external fixator that's made out of materials that could spark. We can't put that in the chamber. Having that idea of safety is really important. There have been some pretty bad accidents and even deaths for people just putting the wrong things in the chamber.
You also mentioned that there was, I don't know where you got the stat from, but there are, I don't know, 18 different types of chambers that are legally sold in the US?
Yeah, there's 18 different types of hyperbaric chambers from 11 different countries being illegally imported into the US right now. It came from the Undersea Hyperbaric Medical Society's town hall last month. And what that means is they're being mostly imported as like stress chambers or sensory deprivation to circumvent how they get them in. And the challenge with that is some of those may be okay devices, we don't know, but most of them are not made with the right materials. And so, as you, like I was saying, think of the submersible that was trying to go to the Titanic, as you pressurize, depressurize, you're really stressing the materials. And if they're not made out of the right materials and made to do that, at some point you're going to have a catastrophic failure. And if you are inside or even around that chamber when it happens, it's going to be pretty dangerous.
No, that's okay. So this is why we need to do our due diligence and ask all the right questions. And that material
Yeah.
is really important. And I also learned that when you are in these sort of smaller, maybe I guess mono chambers, perhaps, I don't know, you correct me if I'm wrong, but the pipes are very important that they're cleaned and that they're maintained because you could be doing more damage breathing in, I don't know, bad oxygen or too much. And that's something I don't know if how true that is.
So if you have a closed system like hospitals do, or like we have at my office, and you're buying medical grade oxygen, then you should be fine. What a lot of the places that I think you're referring to is they'll use oxygen concentrators. And so you don't know what you're concentrating. They use a corrugated tubing. So they have little divots of area that bacteria, dust, moisture, which is the true enemy, that's where stuff's going to start growing. You don't want to go for a hyperbaric treatment and leave with Legionnaire's disease because, like you said, they used a corrugated tubing and an oxygen concentrator and didn't do their due diligence. Every hospital facility or facility set up like one is going to do third-party testing every year on their medical gases. And so that's something you could ask them for. Hey, do you have your third-party testing? And can I see that your chamber has a national board stamp?
Hmm. Great. National board stamp too. Yeah, show that. And do they have to get it renewed every year, this national board stamp?
The national board stamps once for the device. Some areas, there was a recent incident in Michigan, so the boiler inspectors are going out and kind of hitting up all those facilities right now. So they may or may not show up. But as all these clinics are showing up everywhere, there's no way for them to keep up. A lot of them aren't applying for like a permit for it. So how do you know they're there?
Mhm.
The air testing should be done every year. And it's usually something that if your fire department knows about it, they'll ask about it. But it's such an acute specialty, and most fire inspectors don't realize what they should be looking for. There's actually a whole chapter in the NFPA just dedicated to hyperbaric chambers and the facility that they operate in to make sure that they're safe. Because oxygen reacts so differently under pressure. It's so much more aggressive when you increase the pressure.
Yeah. Yeah. And what is the NFPA, you said? I don't know if
National Fire Protection Agency.
okay.
So they regulate every building and construction, how much oxygen a hospital can have based on square footage, like all those things that could relate to fire in a structure. So there's a whole chapter just for hyperbaric facilities. It's chapter 14, if you want
Cool.
to look it up.
Yeah, yeah, no, because there are risks if you major risks that you could die if you don't go into a proper chamber or it's not manned correctly. So we need to know
Yeah.
these. But let's assume that it is a great chamber and is properly regulated. What are the risks of doing it anyways? Is there any
Yeah.
kind of risk?
The major risk is hurting your ears. So the first thing we do is talk to everyone about how to clear their ears. We usually take a peek inside. Again, if you're okay going through the mountains or flying in an airplane, you're usually fine in the chamber. But some people have had a lot of ear infections as a child and have a lot of scar tissue buildup. They may have trouble clearing their ears. So the last thing we want to do is perforate your eardrum in this process. About 2% of people have issues, and if they do, we can send them to an ENT and they may put tubes in their ears if they feel necessary. There is also something called oxygen toxicity. So we dose oxygen with time and pressure, and you can go too deep and force an oxygen toxic event, or you could just be more sensitive than some people. So oxygen toxicity is just an overstimulation of your nervous system from the oxygen. We know we're causing it. We stop it by giving you an air break, but it can be pretty traumatic. It could be something as simple as getting like double vision, ringing in your ears. You could get some nausea. You could get some muscle twitching. Your body's just trying to burn off that extra oxygen, but it could also trigger a seizure. And so for someone who's not been through that, that can feel very traumatic. So we mitigate that risk by building in air breaks to help prevent it. But if someone has those symptoms, we can also just give you a little air break, let it subside. But it's something you should be aware of. And this is why you want the right staff operating. Because if you start having a seizure and they panic and just bring you up, when you're seizing, you're holding your breath. And now we just cause an embolism too. So knowing how to troubleshoot on the off chance it happens, it's pretty rare, but it's something that can happen. So it's something to be aware of.
Yeah. What are the contraindications?
The only absolute contraindication is an untreated pneumothorax or like a collapsed lung. Relative contraindications, there's a handful of drugs that are contraindicated. Pregnancy. And pregnancy in the US, it's contraindicated. There's a lot of countries that will put pregnant women in. If you were a pregnant woman and got carbon monoxide poisoning here, though, we would put you in because the fetus is going to take up more of the carbon monoxide even than you. But there's just not a lot of women that want to do research to see if it's going to affect the life of the child after to see if it's safe. And that's mostly it. And then we do, like just yesterday, I did a consult on a pro boxer. He was coming in for a lung contusion, not a pneumothorax, but we still sent him for secondary clearance just to make sure you're breathing and we're changing pressures in an air-filled space. So we want to make sure that we're not going to cause further issue in an attempt to treat something else.
Okay, cool. So let's run down the bullet points, what a woman needs to know about hyperbaric oxygen therapy and how to shop for the best place for her.
Yeah. So easiest thing, if you don't have all the knowledge that I have, ask for, let me see the national board stamp. It's going to be welded on that chamber. Then you know it's been through all the rigorous testing for the device. And second would be ask about the training for the staff. Third would be, is there a physician on site? If something happens, that physician should be there and able to intervene. Ideally, that physician has UHMS training because in med school, doctors get about an hour of hyperbaric training in that 4 years. The doctors that tend to embrace this rotate through a hospital that has it, so they get some hands-on training, or they're divers themselves. So we get a lot of doctors that'll say, oh, do 3 hyperbaric treatments for 45 minutes. We're like, that doesn't do anything. So we have an on-site physician staff that's all been trained. So depending upon who you consult with, they know for that indication, you're going to need this deep for this long. That's where we tend to see the results. Having all those components in place are usually pretty safe.
Great. We've got all the information as well as ask for 2 atmospheres. Make sure you're doing that as well.
Yep.
That's kind of an important note to take. You said that the 3 sessions may not give you what you need, and you kind of threw out 10 to 20 sessions. What's the average of sessions? And I imagine it changes for everybody else, but how many sessions do you think most people need?
With hyperbarics, most of the protocols are called Mark's protocols. That's because Mark's did all the research and kind of said it. Most come in around 20 to start. 20 treatments. If you had a uncomplicated surgery you're trying to heal, sometimes you can get away with a little bit less, around 10. Traumatic brain injuries are coming in at 20 to 40. Radiations, usually around 60 treatments because they were really killed all the blood supply. So we have to reverse quite a bit of damage. So 20 to 30 treatments is where most everything has come in. The Tel Aviv study they did for lengthening the telomeres was 60 treatments.
Yeah. How much does this cost?
So it varies from place to place. And then obviously insurance has coverage too. So around 350 to 500 an hour. And if you're doing 2 hours, you got to factor that in. Is pretty customary for cash-based. Insurance is usually a bit more when you're covering hospital facilities and extra physicians or nurses. So that's kind of the realm. Insurance in the US pays for 14 indications. It's pretty cut and dry. So
what is that? Say it again.
FDA approved indications that insurance will cover. There's 14 of them.
Oh, okay. Okay.
Outside of that, you're going to pay cash. There's a bunch that are in the limbo of getting approved. So Crohn's disease, GI, huge research on that and how it helps. That's pretty close to getting approved. Traumatic brain injuries, it's pretty close to getting approved, meaning insurance will start covering.
So what are the top 5 most approved?
Besides dive injuries would be radiation, osteomyelitis or osteonecrosis, compromised grafts or flaps. So you had surgery and some of that tissue is dying. It will kick in to cover that. Diabetic wounds. And then all the other indications are emergent. So carbon monoxide poisoning, flesh-eating bacteria doesn't like oxygen. So we'll use it to help with that. Like I said, the dive injuries, gas gangrene. Yeah, usually the rest of them you'll be in the hospital for.
We're talking about US-based health insurance coverage.
Yes.
on average? Because I imagine there's some will be like, no, it's not part of your coverage, and others will be like, yeah. But you are seeing these top five more or less being covered by most of the insurance companies.
Yes. Yeah.
Okay. Yeah, because that can get up to like 15 grand more or less to
Yep.
get treated. So if you,
Yeah.
when you said radiation, I'm wondering a woman who's gotten a mammogram and she wants to offset it, could she go in and use this to offset the radiation from a mammogram?
Yeah. Yeah, you could.
And how many sessions would you need for that?
It would probably one that's a little bit lower, like 3 to 5 sessions, because it's a single dose. When you do radiation therapy, you're coming every day for 3 to 6 weeks and they're blasting one spot. And another great thing to do if you're going to have a mammogram, an x-ray, is just take some iodine and protect that thyroid.
How much?
I don't even know what the pills I have downstairs are, but I take it for like 3 days before and after, and then just move it to like once a week. You can
Hmm.
do the liquid, I think it's like 500 units, but most of the low dose iodine, your thyroid takes the most of the abuse when you do any kind of radioactive therapy. So protect that with some iodine. And it's not really our food anymore. We don't iodize our salt, so it's harder to get if you don't eat a lot of kelp.
Interesting. Okay, so maybe 500 units more or less of iodine 3 days before your mammogram or x-ray, and then every day for 1 week after your
Yeah,
mammogram.
just kind of prevent it from getting in there and help clear anything out.
Hmm.
Yeah.
Cool. Okay, so that's a generally higher dosage of iodine that you'd be taking every single day. I mean,
Yeah,
so
you wouldn't want to
women,
do that long term.
yeah,
That would
yeah.
be bad. You're just trying to kind of bolus it and flush it out and then go back
Mhm.
to your normal life.
Interesting. Okay. So yeah, we love ways to offset in things.
Yeah.
And there we go. We can offset it with the hyperbaric and with the iodine. And oh, this is really, really interesting. I'm so glad I got a chance to speak to you and just really start to understand more about hyperbaric. Where can we find out more information about you? And your clinic is called Under Pressure. And I have a link to that in the show notes. But where can we send people to find you?
Underpressure.com. We're on Instagram and Facebook at Underpressure Hyperbarics. If you just want to shoot me an email directly, info@underpressure.com. I do a lot of consulting to help people find the right facilities or doctors that want to kind of put this in, do it the right way.
Yeah, because your clinic is in Los Angeles, right?
Yes. Yeah.
And you don't have any other clinics anywhere else?
We are in construction for our second, also in Los Angeles. And then we have a couple other states that we're looking at expanding to currently, but right now we're just in LA.
Oh, cool. Are there any websites or review sites or Facebook groups where people are sharing where is a good place to get hyperbaric if they can't get to LA?
Yeah, so if you go to the UHMS, stands for Undersea Hyperbaric Medical Society, they have a database of all the facilities that they have inspected themselves and approved. I think there's at least 600 that have passed their inspections. Not every hospital is even approved yet because it takes a while to get in line and all the things. So that's a really good spot to start. And it's not just hospitals that are in there. There are some private clinics that are starting to seek out the inspection and get in line because it does take a while for them to come out, but that's a great resource to find a good facility. They test the staff, they test the equipment, they test the building, they go through everything. It's like a 600-point inspection.
Oh, fabulous. Okay, that's really cool. And then that's only US? Do you have any contacts outside of US?
That's only US, not a lot of international conferences that combine info yet. In
No.
the US, we are the farthest behind. You go to Japan, there's like 200 indications that their healthcare system covers. Even our veterinary association here approves, I think it's 126 indications to put your dog or cat in the chamber,
Mhm.
but only 14 for us still. So
Wow. Oh, so hyperbaric is more advanced in other countries?
it's more widely used. I
Okay.
wouldn't say it's more advanced. The technology is the same. It's their healthcare systems approve more. Most nations are a bit more on the preventative care. We're more reactive in the US.
Cool. Well, if anybody wants to reach out to you, I'll have a link to everything and your email as well in the show notes, and they can ask you questions about it. You can go reach out to Nicole in LA if you want to go to Under Pressure. And if you are also out there, use the code Zora. You gave us a little code for a
Yeah.
15% off your treatment. So that's really, really nice. Thank you so much, Nicole. Is there any last words you'd like to share with our menopausal audience?
I feel your pain and I'm sorry. But staying toxin free is usually your best bet. Hyperbarics is amazing, but staying ahead of the curve and just seeing what's going into your body really does make a difference.
Awesome. Wonderful. Well, thank you everyone who's made it to the end. I hope you have a good day, good night, good morning, wherever you're at. And Nicole, have a good rest of your day.
Yeah, thanks. You too.
Bye-bye.
Bye.